Hello, my name is Kim Walker and I'm a Capacity Building Associate with the National Alliance to End Homelessness. Welcome to the fifth and final module in our training on rapid rehousing, reducing homelessness using a rapid rehousing approach. This module, entitled Outcomes, Community Examples, and Evaluation, reviews some of the data available on the outcomes of rapid rehousing programs and provides examples of communities that have implemented the model successfully, with a special focus on communities that have served populations with moderate and high barriers to returning to housing. It also discusses ways communities can evaluate their success with implementing rapid rehousing. If you have any questions about this training or rapid rehousing in general after this presentation, please feel free to send them to thecenter@naeh.org. Let's start by looking at data on exits to permanent housing from the different intervention types. The data on this slide is aggregated from the Alliance's performance improvement clinics. The capacity building team conducts these 1.5-day clinics across the country to help communities align their homeless assistance systems with best practices and the new HEARTH Act regulations. As part of these clinics, we gather data from communities on how their system currently functions to provide better advice on how to move forward. We at the Alliance worked with our colleagues at Focus Strategies to aggregate data from 14 of our performance improvement clinic communities. These 14 different communities represent a diverse range of areas. The aggregated data on this slide shows a clear trend in terms of percentage of exits to permanent housing in a given year for single adults, and that is that rapid rehousing has by far the highest percentage of exits to permanent housing of all the interventions at 75%. A bit less than half of individuals exiting transitional housing in these communities exited to permanent housing, and only 16% of individuals in emergency shelter who exited to permanent housing in a given year. The aggregated data we have on families shows the same trend, with rapid rehousing again being the most successful in terms of percentage of exits to permanent housing. As the rapid rehousing model is based around providing quick exits to permanent housing, this makes sense. The next two slides provide data on the cost effectiveness of rapid rehousing from two different individual performance improvement clinic communities. This slide features data from a community with both rural and urban areas in Washington state. Here we see two sets of bar graphs. The one on the left shows the average cost per exit in their system for each intervention, meaning the average cost for individuals to enter and exit or be served by that program type. We get this number by obtaining the budget of each program we have data for, aggregating the data by intervention, so for example, putting all of the transitional housing program budget data together and doing the same for emergency shelter and rapid rehousing, and then dividing the total costs for each intervention, the total budget, by the number of exits each year from that intervention. The bars on the right show the cost of exits to permanent housing from each of these interventions, which is calculated the same way, except that only data on exits to permanent housing is used in the calculations. As we can see here, exits from shelter in both categories are the cheapest. Transitional housing exits are the most expensive in both categories, and rapid rehousing falls right in the middle in both categories. For added context, for both individuals and families in this community, the rapid rehousing programs have the highest percentage of exits to permanent housing of any intervention. Here's some data from a city in California we did a performance improvement clinic with. This table lays out the costs and outcomes of emergency shelter, transitional housing, and rapid rehousing for families. We bolded the best outcomes in the chart. In terms of average cost per exit to permanent housing, rapid rehousing was by far the cheapest, with transitional housing costing more than 5 times as much per exit to permanent housing. Similarly, rapid rehousing had the highest percentage of exits to permanent housing. Transitional housing and rapid rehousing programs were tied for the lowest return to homelessness rate, just 2%. Returns to homelessness are counted here when a household exits the homeless assistance system and then returns to homelessness later on, usually as counted by HMIS within a set period of time. Across the board, rapid rehousing had the best outcomes in each category. As we will see, these individual examples do not represent isolated cases. This aggregated data from the 14 communities shows the same trends that we saw in the last two slides. For individuals, transitional housing had the most expensive exits in general and the most expensive exits to permanent housing on average. Rapid rehousing had the least expensive exits to permanent housing, costing around 3 times less than exits to permanent housing from transitional housing. The aggregated data for families tells a similar story. Transitional housing exits are the most expensive in both categories on average. Emergency shelter has the least expensive general exits, and rapid rehousing had the cheapest exits to permanent housing. Transitional housing exits to permanent housing are around 5 times more expensive than rapid rehousing exits to permanent housing. Let's now take a look at returns to homelessness from the different program types. Returns to homelessness are one of the main Hearth Act outcomes that communities will be expected to measure in the coming years. Many communities do not yet gather this information, so we only have 7 performance improvement clinic communities data here instead of 14. With this data, we see that shelters have the highest rates of return to homelessness for individuals and for families. For individuals, transitional housing had the lowest return rate at 7%, while for families, rapid rehousing had the lowest at 4%. Let's switch gears a little bit and discuss some specific examples of success that communities have had with the implementation of rapid rehousing. We have more information on all the communities I'll discuss next on our website. I'll start with the Community of Hope, a program in Washington, D.C. Community of Hope used Homelessness Prevention and Rapid Rehousing Program, or HPRP, funds to do rapid rehousing with some of the families they serve. As you may know, D.C. is a very expensive rental market. It had a fiscal year 2012 fair market rent, or FMR, of $1,506 for a two-bedroom apartment. Despite these high costs, of the 50 families that exited HPRP in 2011 through Community of Hope, 90% remained stably housed as of July 2012. The average length of subsidy was 12 and a half months. Hennepin County, Minneapolis, Minnesota has a long history with rapid rehousing. For reference, fair market rent for a two-bedroom in Hennepin County in fiscal year 2012 was $904. Hennepin was especially interested in targeting those families with moderate and severe housing barriers for their rapid rehousing program. Within a week of entering shelter, which is a right for all homeless families in the area, all families are assessed for their rapid rehousing needs. Case managers do housing, criminal, and background checks to help expedite the process of finding a suitable housing arrangement for the household. With this process, Hennepin has seen a return rate of only 9% after 1 year and 15% after the second. Another example of a very successful rapid rehousing program comes from Salt Lake City and County, Utah. Salt Lake combined their Temporary Assistance for Needy Families, or TANF, HPRP, and other state and local funding sources to serve over 600 families through rapid rehousing. They specifically targeted families that were already living in shelter or on the streets to participate in this program. The program staff included a program coordinator, a landlord negotiator, accountant, data specialist, case managers, and an assessor. Over the period of study between October 2009 and May 2011, only 8% of families served by rapid rehousing returned to shelter. Let's end by talking briefly about evaluation. Programs should be tracking how quickly households are moving into permanent housing to start. Programs should see quick turnarounds once a household enters the homeless assistance system to keep lengths of stay down and minimize the stress for the household. Programs should also be tracking housing retention, both during the program while the household is still receiving a subsidy or case management and after the household is receiving no assistance at all. Returns to homelessness should also be tracked carefully. Returns within the first year are generally relatively rare, with many programs reporting a rate of 10% or less. Those households returning may need additional assistance or need to be targeted for a more intensive intervention, such as permanent supportive housing. This concludes Part 5 of our training, Reducing Homelessness with a Rapid Rehousing Approach. This is the final module in the series. The previous 4 modules provided information on housing barrier assessment, housing search, and developing landlord relationships, subsidies, and voluntary service provision, in case you missed them. Thanks for your time.